Hello and welcome to this month's Medcan Online Seminar. My name is Tanya Haas and I am the in-house health and wellness writer here at Medcan. Thank you very much for joining us. The information in this online seminar is for educational and information purposes only and is neither intended to be relied upon nor to be a substitute for professional medical advice, diagnosis, or treatment. Now, with all that being said, I'm very excited to introduce our presenter today, Nadine Khoury. She is a registered dietitian and the clinic manager of nutrition here at Medcan. She is a Toronto-based registered dietitian who was educated at McGill University and Ryerson University. She has over 20 years of experience as a health and nutrition educator, and she is registered with the College of Dietitians of Ontario and has served as a Dietitians of Canada representative on several working groups. Nadine joined Medcan in 2008 and prior to this held a clinical dietitian position at Sunnybrook Hospital. She uses behavior modification theories and multiple adult learning styles and techniques to help diverse groups and individuals in achieving their goals, and I'm so happy to have her presenting today. Thank you so much, Nadine.
Thank you, Tanya, and thank you everyone for joining us for this webinar. Let's get started by going over the outline of what we will be discussing today. We will start by reviewing the definition of inflammation, the types of inflammation, and their effects on our health, which will lead us to the role of nutrition, and then we will wrap up with some practical recommendations on how to reduce inflammation in the body with food. So what is inflammation? Inflammation manifests itself when the immune system is poked by some kind of irritant, like a food you're sensitive to, an environmental toxin, a foreign invader like bacteria, or a viral infection, or even an injury. The inflammatory response to an invader or injury is essentially an immunological response, and it's characterized as acute or chronic. These are the two types of inflammation. This slide explains the difference between acute and chronic inflammation. In acute inflammation, the body calls immune cells and fluid to the irritated area to help kill whatever's there. So it is a protective response to remove harmful agents and enable the tissue to heal. This usually lasts a few minutes to a few days. It's a process that has a self-limiting feedback loop that stops the inflammatory response once the harmful agent is dealt with. But fighting foreign invaders takes energy, so acute inflammation typically increases metabolism. On the other hand, chronic inflammation is a long-term, low-level systemic physiologic response where there's ongoing stimulation of the immune system from either ongoing exposure to an environmental toxin, microbial or viral infection, poor nutrition, food sensitivity or intolerance, stress, or aging. If this goes unchecked and becomes uncontrolled, the immune system becomes overactivated. A series of destructive reactions can then damage the cells, which will eventually lead to the clinical symptoms of chronic conditions. And because this can last weeks to months to years, this type of inflammation is linked to increased disease. So instead of speeding up metabolism, this type of inflammation actually decreases or slows down our metabolism. Medical focus has been on blocking inflammation through, for example, anti-inflammatory medications, rather than helping to resolve the source of the inflammation. And this, over time, limits the body's ability to deal with the irritants or invaders on its own. Effects on health. So what are the effects of inflammation on our health? These are some of the symptoms used in research that are linked to inflammatory biomarkers being elevated in the body. And as you can tell, there are so many of them that are very common, like migraine headaches, irritable bowel symptoms, inflammatory arthritis, acid reflux, depression, insomnia, low self-esteem, binge eating or craving certain foods, food allergies. So they're very, very common. These are some of the disease states that are associated with elevated inflammatory markers. And you'll see there are many chronic conditions that are related to chronic inflammation. The development of a specific disease depends on the site of the inflammatory response. So for example, disruption in the action of the cells in the kidneys will result in renal disease, where damage to intestinal cells will lead to inflammatory bowel disease. So although the underlying factors that trigger different diseases may vary, the pathology linking chronic inflammation to disease onset is marked by the same processes. So how does nutrition impact inflammation? Well, nutrition is fundamental in maintaining normal immunity and attacking disease. Nutritional deficiencies are associated with an impaired immune response. So it is very important to consume and absorb nutrients like iron, selenium, zinc, vitamin B6, vitamin A, C, and E, which are all antioxidant family of vitamins, fiber, probiotics, phytochemicals, and essential fatty acids like omega-3s. They are all essential for an optimal immune response. We know that following an energy-dense, nutrient-poor Western-style diet has a negative impact on the gut microbiota and immune system, which traditionally requires a high-fiber, more plant-based diet. And because 80% of our immune system resides in our digestive tract, and many nutrients are involved in normal immune function, what we eat should be the first tool in preserving our health. Let's dig a little bit deeper in how nutrition plays a role. Unstable molecules, called free radicals, are normally created during metabolism and aging. Sometimes the body's immune system cells purposely create them to neutralize viruses or bacteria. But environmental factors like pollution, radiation, cigarette smoke, allergens, and herbicides can also create them and can trigger release of inflammatory cytokines in the body. Normally, the body can handle free radicals by neutralizing them with antioxidants from the diet. But if antioxidants are unavailable, or if the free radical production becomes excessive, damage to the cells can occur. Chronic inflammation begins in the fat cells in response to overeating the wrong foods. So abdominal obesity can trigger a cascade of inflammation. What happens is fat cells grow, multiply, and change shape. This stimulation of the immune response causes fat cells to become insulin resistant, which can lead to prediabetes and then diabetes or fatty liver, which are all risk factors for cardiovascular disease. It has been shown that if you have elevated markers of inflammatory cytokines, those are the ones in the circle in the middle of the picture, this can also predict and even precede your future weight gain. So obesity can trigger inflammation, and inflammation can trigger obesity. Diet and inflammation. If you were to search Google for anti-inflammatory diet, you would find more than 15.4 million hits because people are starting to recognize that we all need to work on a strategy for eating to reduce inflammation in the body. But there are many conflicting messages. And because this is an area that's still emerging in research, let's review the evidence we have so far that reveals how certain foods and eating patterns can cool this response in our bodies. Let's start with the pro-inflammatory nutrients. So as we've seen 2 slides ago, overeating can stimulate fat cells to grow, which can lead to abdominal obesity, which can increase inflammation. Studies have shown that reducing calorie intake by 30% can decrease blood levels of inflammatory markers, can reduce body fat, improve weight to height ratio, improve sugar levels in the blood and the insulin sensitivity to that sugar, as well as improve blood cholesterol levels. Refined carbohydrates from foods made with processed flours that are typically low in fiber and rich in sugar and starches turn very quickly into sugar in the body. And because of that, they produce a high glycemic value based on the glycemic index scale, a scale that looks at how different starchy foods affect the spike in blood sugars. Studies have shown that inflammatory markers were 3 times higher in individuals consuming a high glycemic index diet. Canadian intake of added sugar is around 40 kilograms per person per year, or 26 teaspoons per day. And the actual recommended intake of added sugars should be limited to no more than 6 teaspoons per day, or 5% of calories, based on the World Health Organization. So you can see that there's a big gap here in what we're getting in terms of refined carbohydrates and what we should be getting. Trans fats from processed foods are very inflammatory. Trans fatty acids come into our diets from hydrogenated oils, fast food, fried foods, processed snack foods, frozen breakfast products, cookies, donuts, crackers, and most stick margarines. Studies have shown that trans fatty acids become integrated in the human heart cells, causing them to clump together and bind to the arterial walls at twice the rate of other fats. And because of this, they stimulate a big release of inflammatory markers in the body. Saturated fats from processed meats, deli cuts, and sausages are also inflammatory. A diet containing about 12% saturated fat, which is comparable with the level contained in an average Western-style diet, was found to increase body fat and elevate levels of inflammation. I want to note here, though, that it's not all saturated fats that have an inflammatory effect on our bodies. Saturated fat from dairy products, especially cheese, has been shown to have a neutral effect on inflammation, which is good news for cheese lovers. Our consumption of omega-6 fats from corn, safflower, sunflower, grapeseed, soy, peanut, and other vegetable oils, and many salad dressings has also significantly increased in the last few decades in the Western world. Both omega-3 and omega-6 fatty acids are necessary for normal body structure and functioning. So consuming the correct ratio between the two is very important because they work together in the body. An ideal ratio of omega-6 to omega-3 is 1 up to 4 to 1. But a typical Western diet provides an omega-6 to omega-3 ratio anywhere between 10 to 1 to 20 to 1. This change has been associated with increased risk of chronic inflammatory diseases, including plaque formation in the arteries, atherosclerosis, and cardiovascular disease, rheumatoid arthritis, and irritable bowel disease. This takes us to the nutrients that have been shown to have a positive impact on inflammation. The omega-3 fatty acids, EPA and DHA, are found mainly in fatty fish like salmon, trout, Arctic char, sardines, and fish oil supplements. They suppress the production of pro-inflammatory markers and stimulate the synthesis of anti-inflammatory markers. Consuming approximately 3 ounces of fatty fish 5 times per week for 8 weeks resulted in significant lowering of pro-inflammatory markers. Also to note, chia seeds, walnuts, canola oil, and flax seeds are good sources of omega-3 fatty acids, but they contain the alpha-linolenic acid version of omega-3, which takes a long time to convert into the active DHA in the body. Because this happens at a very slow conversion rate, it's less effective in reducing inflammation in the body than the DHA and EPA that typically come from fish oils. Vitamin C is a powerful antioxidant that defends cells against cell oxidation and free radical formation. It's also important in collagen synthesis, so it's important in reducing tissue damage at the inflammation sites. Taking a supplement of 1 gram per day of vitamin C has been shown to have a positive impact on symptoms of rheumatoid arthritis and high blood pressure. But even consuming approximately 70 milligrams per day of vitamin C from, say, a vegetable soup will significantly reduce plasma levels of inflammatory markers. Vitamin E exists in nature in different chemical structures. The most common forms in the diet are alpha and gamma tocopherols. Foods rich in vitamin E are seeds, nuts, and vegetable oils. Supplements, however, commonly contain only the alpha tocopherol form. Studies have shown that it's both structures, alpha and gamma tocopherols, that work together, and they have a synergistic effect on inflammation in the body. So it's best to get your vitamin E from consuming a handful of nuts about 4 to 5 times per week. This seems to reduce inflammation, and it can be related to both the vitamin E content and the fiber content of nuts as well. Polyphenols and phytochemicals are available in many plant-based foods. They are aromatic compounds that are found in citrus fruits, cabbage, onions, berries, green leafy vegetables, tea and cocoa, olive oil, red wine, many spices, and flax seeds. So many polyphenols have shown powerful anti-inflammatory effects, antioxidant effects, as well as anti-proliferative effects or anti-cancerous effects. Prebiotics are foods for our healthy gut bacteria. Prebiotic foods come from chicory, Jerusalem artichokes, and onions, or inulin, which is also an additive in many commercially prepared foods. But it can also be sold as a dietary supplement. Probiotics are often called friendly bacteria that have health benefits in our bodies. They're found in cultured foods like yogurt, kefir, and fermented foods like kimchi and sauerkraut. They also come in a supplement form. Both prebiotics and probiotics appear to interact directly with gut cells to block invaders or pathogens from entering our bodies. So consuming cultured foods, cultured dairy foods, has been found to reduce symptoms of irritable bowel disease and ulcerative colitis. Clinical trials have shown the anti-inflammatory effects of prebiotics in patients with diarrhea, in ulcerative colitis, and precancerous colon polyps. Probiotics can also be used with antibiotics to help prevent diarrhea that may come with taking antibiotics. Practical guidelines. Nutrition intervention has a positive effect on many, if not all, inflammatory conditions like cardiovascular disease. It can improve inflammatory markers in cancer and autoimmune conditions like rheumatoid arthritis and celiac. It can even improve behavior and attention in children with autism and ADHD. If you were to work with a registered dietitian at Medcan, the first step in getting started with an anti-inflammatory diet is to figure out if you have any food triggers for the inflammation. We start by reducing or eliminating the obvious triggers we've just discussed. But these are the most common food triggers for inflammation. In addition to that, there are food allergies or food intolerances that can cause inflammation. So it's important to rule those out as well. The most common food allergens are eggs, fish, milk, nuts, shellfish, soy, and wheat. But some people are also sensitive to MSG, aspartame, and even alcohol. If you feel you have an inflammatory condition like irritable bowel syndrome, working with a dietitian can help you isolate food triggers for your symptoms by following an elimination and challenge diet approach, or by using the results of a food intolerance test. Let's wrap up by giving you some practical recommendations that you can start today to reduce inflammation in your body. Variety is very important to meet all nutritional needs. Choosing fresh, less processed, less refined, local, and organic meals as much as possible is a good place to start. Meal timing and balance is important to aim to get some carbohydrates, protein, and fat at every meal, and trying not to go over 5 hours without eating during the day is also recommended. Fruits and vegetables should be the basis of every meal and not be considered as simply a condiment to a meal. So focusing on getting lots of colors, green leafy vegetables, vegetables from the cruciferous family like cabbage and broccoli, and from the allium family like garlic and onions, berries and cherries as well, are all very good anti-inflammatory foods. You should aim to get 4 to 5 servings of each of fruits and vegetables daily. It sounds like a lot, but really the servings are small. The servings are only half a cup for cooked or raw vegetables or 1 cup of salad. Including whole grain foods regularly like oatmeal, brown rice, quinoa, buckwheat, and other unrefined grains is very important because they are high in fiber, and fiber helps with inflammation. You can have oatmeal for breakfast, or add flaxseed to a morning shake, or replace refined breads with more whole grains like rice and quinoa. brown rice and quinoa, and keeping your portions of carbohydrates to a quarter of your meals is a good idea. Replacing some of the animal proteins with plant-based proteins like beans and organic soy is good. They are high in fiber, but they're also loaded in antioxidants and many other anti-inflammatory substances. Healthy fats from nuts, extra virgin olive oil, fish, and avocado in place of butter or margarine. Having a handful of nuts 4 to 5 times per week, and cooking with olive oil as much as possible and using it for salad dressings. Consuming about 4 tablespoons of olive oil per day has been shown to have big anti-inflammatory effects on the body. Eating fatty fish 3 to 4 times a week will give you a good amount of omega-3 fatty acids. Getting wild sockeye salmon instead of farmed salmon is good because sockeye salmon cannot be farmed. It's lower in the food chain and has less contaminants and more omega-3s. Preparing meals with herbs and spices like turmeric, which is in curry powder, ginger, cinnamon, and cloves have all been found to have anti-inflammatory effects. Substituting some of the tea for coffee will give you a huge antioxidant effect. If you are a drinker of alcohol, choosing red wine is a good idea. It has many protective pigments. And dark chocolate with a minimum of 70% cocoa content is good as well, very anti-inflammatory. Cocoa butter is a good quality chocolate is a healthy fat that the body perceives like olive oil. But in cheap chocolate, the cocoa butter is removed and is replaced with milk fat or other fats that are cheaper and not as healthy. This is the anti-inflammatory food pyramid based on the Mediterranean diet, which has been studied extensively in many settings and has been shown to be one of the healthiest dietary patterns you can follow to not only reduce inflammation, but also reduce cardiovascular disease risk and many other chronic conditions. It's characterized by generous consumption of vegetables, fruits, grains, legumes, and nuts, minimal intake of red meat and whole-fat dairy products, increased fish consumption, moderate red wine intake, and liberal use of olive oil in cooking and food preparation. Compared with Western diets, the Mediterranean diet is rich in fiber, polyphenols, antioxidants, and omega-3 fatty acids, and it's low in saturated fats and refined carbohydrates. So following a Mediterranean-style diet pattern will reduce the risk of cardiovascular disease and inflammation, regardless of whether you lose weight or not. I would like to conclude by saying that anti-inflammatory benefits are derived from the synergistic effect of foods eaten together, as well as from individual foods, and small changes can play a major role in improving your health. So focusing on personalized goals and setting achievable objectives, like eating an extra serving of vegetables at lunch, for example, is key to making lasting dietary changes that will combat inflammation and improve your health overall. Thank you.
Thank you so much, Nadine. Now we will get to questions in just a moment, but I'm going to take a few moments to discuss nutrition at Medcan. So nutrition is a central pillar of health and wellness, as Nadine has been speaking to. And our registered dietitians work with their clients to establish realistic goals and provide you with the tools you need for healthy eating. They counsel in one of the following areas: nutrition therapy, digestive health, healthy eating, and sports nutrition. Now, if you look at the screen, you can see some details on those 4 different categories. So if you have a specific condition like IBS or ulcerative colitis, Crohn's disease, they can focus on that. Or if you're trying to understand better nutrition, label interpretation, meal planning, or perhaps you're training for a big race, how can nutrition help you with your goals? So if you are interested in learning more, please give us a call at 416-350-5949, and our nutrition coordinator would be happy to answer any questions. Or you can email us at nutrition@medcan.com, and all that information is also on your slide. So now we're going to go to questions, and thank you very much.
One of the first questions here regarding Crohn's disease. So without going into an entire session, condition have any specific recommendations?
Absolutely. Crohn's disease is an inflammatory condition, and we work with clients that have Crohn's disease, and some of them are on medication, but changing the diet and making healthier choices will impact how you feel and your symptoms, regardless on whether you're on medication or not.
Okay, thank you. Now, everyone is different, but how long would it take for someone who is avoiding the trigger foods for them to notice a difference in their inflammation, for that inflammation to go down?
Usually when we're doing an elimination diet, we start people on eliminating the most trigger foods to them for at least 4 weeks, up to 6 weeks. And that could be longer if they don't feel better. We keep trying until they start feeling significant improvement.
Mm-hmm.
Once they feel about 85-90% better, that's when we will start challenging the diet with trialing foods one at a time to figure out what are food triggers.
Okay, thank you. Now, you said processed sugar should be avoided. What about honey or maple syrup?
So honey and maple syrup are natural sugars, but they are recognized in the body as the same. They're added sugars, so they do add empty calories. Yes, there's more antibacterial, antiviral effects in maple syrup, for example, or honey. They're more natural, but the body recognizes it the same. So it will spike your blood sugars the same way as a teaspoon of table sugar.
Okay, thank you. Now, a lot of people online are writing about intermittent fasting. So one person who's here today is asking, I've heard that fasting for 5 hours is a good idea. You didn't speak to that.
Yeah, there's so much to speak about. So we didn't get to timing of meals as often as much as I could have. Usually we recommend eating within an hour of waking up and not going longer than 5 hours without eating, because the metabolism tends to slow down if you don't eat for longer than 5 hours during the day. Obviously, after dinner you can stop eating and you can go to sleep on a lighter stomach and then wake up and have an appetite for breakfast. So that's the idea. The idea is that you eat within an hour of waking up, not longer than 5 hours apart, and then stopping food intake after dinner, unless you're very active in the evening and you need something to keep you energized.
Okay. And what about probiotic pills? That was, you mentioned probiotic and prebiotic. So do you recommend probiotic pills for your clients?
If you're someone that is allergic to dairy products and you can't take fermented dairy foods like yogurt or kefir, and you don't like sauerkraut, for example, taking a probiotic is a good idea. And if you have specific conditions that are very inflammatory, taking a probiotic regardless of your intake from diet is a good idea, because you get so much more in a pill, so it will have a bigger impact on reducing inflammation in your gut.
Okay, and so this is our last question. Someone had read that dark shade vegetables like eggplant, sweet red peppers, vegetables, they should be avoided. Are those considered anti-inflammatory? Or
it really depends. I think there is some evidence in terms of rheumatoid arthritis. It's not a blanket statement for all inflammatory conditions, so we don't typically avoid them for all because they're so healthy. So it really depends on your condition, and we might look at limiting them if you have certain conditions.
Okay, well, I want to take the moment to say thank you very much, Nadine, for your wisdom, and thank you to all of our participants. We will follow up with an email. We have a survey, but also we will send you a note when this presentation is available online. Thank you very much for all your questions, and sorry we weren't able to get to all of them. If you have any questions, go to our website or email us at nutrition@medcan.com.